Good afternoon, everyone. My name is Justyna Faszcza. I am a lawyer and psychologist speaking on behalf of the Foundation for Women and Family Planning, FEDERA. Next slide, please. For over 30 years, FEDERA has stood at the forefront of the struggle for reproductive justice in Poland, defending access to SRHR. Today, I will show how FEDERA, as part of grassroots feminist movement, has resisted one of Europe's harshest abortion regimes and continues to build access to care where the state denies it. Let me begin not with the law, but with the life. Next, please. In 2021, Izabela from Pszczyna was 22 weeks pregnant. Her waters broke and the fetus had no chance of survival. Doctors refused to terminate the pregnancy, saying they had to wait for the fetus to die. Izabela texted her mother, fearing sepsis. And she was right. She died of septic shock. And her death was not an accident, but a predictable result of Poland's near-total abortion ban. Next, please. Until 2020, abortion was legal only in 3 cases: when the pregnancy endangers a woman's life or health, resulted from a crime, or involves severe fetal defects. Even then, it was already one of the most restrictive laws in Europe, a fragile so-called compromise. In October 2020, the politically captious Constitutional Tribunal removed the fetal defect ground, declaring it unconstitutional. Since then, abortion has been lawful only on 2 grounds, and that remains the law today. Next, please. And what's important in this context is that under Polish law, a woman is not punished for abortion herself, but anyone who performs or helps her outside those 2 narrow grounds faces up to 3 years in prison. It can be more if the fetus is viable outside the womb. This criminalization isolates women and endangers lives. Those seeking abortions outside the system are left alone, afraid to ask for help, even from those they trust. It also creates what we call the chilling effect. Even when abortion is lawful, doctors often refuse to act, fearing prosecution, social backlash, or institutional pressure. Hospitals delay procedures, demand unnecessary consultations, or hide behind paperwork. In this way, fear itself becomes a barrier to care. FEDERA had warned and observed these consequences long before the tribunal's ruling. Next, please. The ruling's impact was immediate and devastating. Over 90% of legal abortions in Poland disappeared overnight. In practice, even the 2 remaining exceptions were almost impossible to access. What followed was not a breakdown of law, it was a collapse of care. Doctors refused even legal procedures or demanded endless tests, passing patients from one to another, while time slipped away. We lost Izabela, Dorota, Justyna, and more, who died after delays or denials of care. Hundreds of women reached out to us in panic, unsure what would happen or whom to trust. Some had just received fatal fetal diagnosis. Others were already in hospital waiting for abortion when the ruling came into force. Next, please. Polish women had already mobilized in 2016 during the so-called Black protests, when a bill proposing total ban was introduced to parliament. Thousands took the streets under umbrellas, symbols of resistance and solidarity. FEDERA was part of the movement that turned it into change. Since then, we say, we don't put our umbrellas down. The 2020 ruling and the deaths that followed sparked the largest protest since the fall of communism in Poland. Amid fear and anger, a new sense of solidarity emerged, which reminded us change will not come from those in power. Next, please. Soon after came another crisis. Following Russia's full-scale invasion of Ukraine in 2022, millions, mostly women and children, sought refuge in Europe. Poland became one of the main destinations. Exhausted and traumatized, many needed medical care. Like Uliana, who survived wartime sexual violence and discovered she was pregnant just after arriving in Poland. She called us begging for help, wanting only for it to end and to focus on her children waiting for their father at war. Many like her did not realize how restrictive Polish law is, that abortion is almost entirely banned, that access to contraception is limited, that doctors refuse care under the so-called conscious clause. Federa provided information, counseling, and referrals, ensuring those fleeing war did not face another battle with the Polish healthcare system. Next. And as we meet today, the law remains unchanged. Poland still ranks among the lowest in Europe for access to abortion and contraception, the only EU country without reimbursement for modern contraceptives. And the war in Ukraine continues. Next. So Federa also continues to confront systemic barriers and build sustainable care where the state fails. Drawing on decades of struggle, we have developed a multi-layered strategy to make safe, guaranteed reproductive healthcare a reality. Our work integrates direct assistance, education, litigation, advocacy, ensuring that rights on paper translate into access in practice. Next. So first, we make sure no one in need is left alone. Every year, we support thousands of women in Polish, English, and Ukrainian. We run 2 helplines, the Abortion Intervention Helpline and the Trust Line, with a team of gynecologists, psychologists, sex educators, pharmacists, and midwife. At the height of refugee arrivals, we provided Ukrainian-speaking doctor. We also offer email counseling. Women contact us in fear and anger, and every call is a different story. I've just left the doctor's office. My baby is severely ill. What do I do? Where can I get pills safely? Will I go to prison? They ask for confidentiality and accuracy, and we give them comprehensive information and refer them to trusted doctors and hospitals across Poland. And in 2025, we took another step forward. We launched Maya, our 24/7 chatbot. Maya provides accurate, anonymous, multilingual information about abortion, contraception, patients' rights. It is instant, safe, reliable. Next. Raising awareness is the foundation of lasting change. We distribute brochures on SRHR. We educate youth, adults, professionals. Federa Ponton Group delivers modern sexual education, informing young people about consent, safety, healthy relationships. Our legal and advocacy team complements this with the trainings on reproductive rights. Following the humanitarian crisis, this effort was expanded to include refugees from Ukraine. We organize legal, sex ed, self-defense workshops, all to help people navigate the Polish healthcare system and feel safe again. Next. We defend individuals and push for systemic change. Through our strategic litigation program, we intervene in hospitals and represent women denied care. Many lawful abortions have taken place only because we stepped in, and sometimes when women were hours from death. Since 2020, we have fought for the recognition of the so-called psychiatric ground, allowing abortion when continuing pregnancy endangers a woman's mental health, especially after adverse fetal diagnosis. We secured several decisions from the Patients' Rights Ombudsman and National Health Fund confirming our legal approach and penalizing hospitals that refused care. We represent women like Joanna from Krakow, whose doctor called the police after she admitted to having an abortion. She was taken to hospital by officers, searched, and humiliated. And we defend medical staff, like Dr. Górnicki, targeted for prescribing emergency contraception without forcing patients into personal confessions. We also bring Poland's reality into the international stage. In ML versus Poland, procedure was scheduled, but the day before it was to take place, the tribunal's ruling came into force and the hospital refused. European Court of Human Rights ruled that Poland had violated her right to respect for private life. Next. Our advocacy turned rights on paper into rights in practice. We prepare legal guidelines for hospitals and prosecutors. We monitor access to contraception and abortion. We train medical staff, making the law not just known, but usable. We bring women's voices directly to policymakers, meeting ministers and MPs, sitting in working groups, demanding laws that protect women instead of punishing them. Our recommendations call for full access to SRHR, including liberalization, decriminalization, wider contraception access. And we make sure the world does not look away from Poland, bringing our reality to international bodies. In 2024, our joint submission with the Center for Reproductive Rights and Partners led the UN CEDAW committee to condemn Poland's abortion law as discriminatory. This was later debated in the European Parliament, helping advance efforts to enshrine abortion rights in the EU Charter for Fundamental Rights. Next. But our work is not only about resistance, it's also about solidarity. We have built a national network of psychiatrists ready to confirm when pregnancy endangers a woman's mental health. From hundreds of interventions, we have developed a map of safe hospitals across Poland, a tool that literally saves lives. Federa also leads the Great Coalition for Equality and Choice, Poland's largest feminist advocacy platform, which in 2023 ran the national campaign, Are You Getting Pissed?, encouraging women participation in parliamentary elections. But resistance does not stop at the border. We coordinate the ASTRA network, bringing together organizations across CEE and Central Asia. ASTRA strengthens feminist cooperation, ensuring that no organization in our region stands alone. Next. Finally, we turn solidarity into creation. In 2024, we opened Federa Health Center in Warsaw, Poland's first NGO-run sexual and reproductive health clinic. Our mission is simple: to provide dignified, stigma-free care that respects each patient's autonomy. As we say, our worldview is your health. The center offers integrated care: gynecology, psychiatry, psychology, endocrinology, sexual health services, including post-abortion care, STI testing, and contraception. In its first year, it has already provided free services for hundreds of patients, including refugees and survivors of sexual violence. It proves that civil society can build what the state refuses to provide. Next. And our work brings results. After the total collapse in 2021, the number of abortions began to rise again. Mental health is formally recognized as a legal ground for abortion. Parliament debated abortion law reform for the first time in 30 years. A new prenatal testing program removed age limits for screening, one of our long-standing demands. These are concrete steps forward, prove that carefully calibrated action can drive real change, even in a hostile environment. However, despite some progress, the situation in Poland remains deeply challenging. Thousands of women still rely on grassroots organizations for care that the state should provide. Abortion remains almost entirely banned. Anti-choice groups continue to harass activists and hospitals. The war in Ukraine goes on. Funding for reproductive rights work is limited. Next. As we often say in Poland, you will never walk alone. Together, we can protect life today and build a rights-based healthcare system for tomorrow. But lasting progress requires solidarity, strong partnerships, and sustainable resources. Next. We invite collaboration across sectors and borders to ensure reproductive rights where states fail to guarantee them. Let's work together with commitment, coordination, and care. Thank you.
Thank you so much, Justyna, for showing us, even in the face of one of the harshest abortion laws in Europe, feminist activism continues to protect and empower people seeking care in Poland. Now let's turn to Hungary.
Okay, yeah. Imagine a Roma woman. She already has 3 children, and she doesn't want another one. She goes to the hospital to get an IUD. But because she doesn't have her period, the doctor says, "Sorry, I cannot do it now." So she goes home and prays she won't get pregnant. Her husband, he refuses to use condoms. He says they're uncomfortable. If she's lucky, she'll get another appointment that fits with her period, but that might take months. And what if she's not lucky? What if she gets pregnant during that time? Well, she would face 2 options: keeping a baby she didn't want, or having an abortion. Abortion is not an easy decision, and in her community, it's often not accepted. And her husband even says, "If you want an abortion, that means the baby is not mine." So, what would you do? Next, please. If she decides to have an abortion, it's not easy. In Hungary, abortion is legal up to the 12th week of pregnancy, but only surgical abortion is available, and it's not free. Compared to the average income, it's very expensive. And before the procedure, she must meet with a family protection counselor twice. And at the first appointment, they try to discourage women from going through with it, as you can see from the quote on the slide. And on top of all of this, the process itself is exhausting. Women have to go back and forth between appointments and locations before they can actually get the procedure. So even if she makes her decision, it still takes time, money, and emotional energy to get there. Many women in this situation decide to have the baby instead. But what happens then? What kind of system do they face when they give birth? In hospitals, women experience medical interventions and procedures without proper information or consent. They're often left alone during labor, treated with disrespect, spoken to in a degrading way. And if you are a Roma woman, the chances of experiencing this kind of treatment are even higher. Next, please. Women experience verbal, psychological, and even physical abuse in hospitals. This is what we call obstetric violence. All of these quotes were said exactly like this to Roma women during labor and childbirth. Hungary likes to call itself a family-friendly country, but in reality, women are often forced to make decisions about their bodies and their lives within a system that gives them very little real choice. If they decide to give birth, they may face obstetric violence. If they decide to have an abortion, they may face stigma, pressure, and mistreatment. If they want contraception, access is limited and full of barriers. But in the same system, something else is happening, something powerful. A model program, a community-based doula service that offers real personal support for women. Next, please. In this program, 7 Roma community doulas work together, support each other, and provide individualized peer-based support to Roma women in their own neighborhood. They offer personal, non-medical support during pregnancy and childbirth. They are there to listen, to inform, to give strength, and to stand by them. They also help women access contraception and abortion care. They offer emotional support and clear information at every step. For some women, they are the only people who take the time to explain their options without judgment. Next, please. Let me tell you a story about a Roma woman who went to the hospital to give birth to her 3rd child. It wasn't the same hospital where she had given birth before. The ambulance took her somewhere unfamiliar. From the moment she arrived, the doctors questioned why she was there. They told her to sit in the hallway and wait, even though she was in pain. Nobody believed her when she said she was having strong contractions. Because the monitor didn't register her pain, they treated her like she was exaggerating. Only hours later did they realize that she was actually in advanced labor. But by then, it was almost too late. Because this was her 3rd C-section, her abdominal wall ruptured. She was rushed to the operating room. And then came the open racism. One of the staff members looked at her and said, "Oh, another gypsy." When she tried to hold on to him for support, he said, "Don't touch me." And even after her son was born, and the doctors congratulated her. The same staff members sneered. "This is a beautiful boy. Look at him," implying that the baby was Roma. The mother couldn't stay silent anymore. She said, "Listen, my baby doesn't even know he was born yet. Babies are not measured by race, I believe." And he replied cold, "Don't talk to me. You're the one on my table." After the surgery, they didn't give her any pain medication. She was left in recovery for 2 days, without food or water, trying to care for her newborn while she could barely move. She went through all of this alone. And today, this woman is one of the Roma community doulas. She stands beside other women in the same hospital where she was once humiliated. She's there so that no other woman has to go through what she went through. Next. And like I said before, she's not alone. It may be a small program, but it shows what real support can look like. Over the past 5 years, these 7 doulas have stood beside hundreds of women during some of the most vulnerable moments in their lives. The numbers may not look impressive, but the change in the community is huge. When the program started, even the doulas weren't sure it would work. They thought women in the community were too shy to ask for support during birth. So the doulas had to be proactive. They reached out to the women themselves. And after the first few births, word spread quickly. Women told each other how good it felt to have someone by their side in the hospital. But birth is only one part of reproductive health. Many women also need access to contraception, which they usually cannot afford, or they simply can't go to the gynecologist because there's no one to watch their children. The doulas support them with these two. Accessing abortion can feel like a maze in Hungary. Navigating it alone is overwhelming. Some women even give up along the way, even though they need care. The doulas stand beside them through this process as well. They also hold women's circles for young girls. They help them feel stronger, more aware of their bodies and their choices. And now, even the boys are asking when their turn will come for sex education sessions. Next, please. The doulas gives the woman something the system doesn't: information, time, and trust. Women know they can talk to them and their personal stories will stay safe. They get space to speak, to be heard, and to have their feelings and experiences respected, not questioned. The presence of doulas at birth helps women have a more positive experience. It also reduces postpartum difficulties, strengthens mother-baby bonding, and it empowers women. The doulas also led by example. They stand beside women at gynecological appointments, and they encourage them to speak up if they feel they're not treated with respect. This is how empowerment grows, step by step, woman by woman. And all of this has led to something powerful. When the community needs support, they turn to the doulas because they know they will get trusted personal support from someone who listens, who understands, and stands by their side. And this program doesn't only change the lives of the women they support, it also changes the doulas themselves, both professionally and personally. Next. As they create space for other women, the organization creates space for them. There is mentoring, case discussions, supervision, ongoing learning, and team building. These all strengthen their skills and their bonds with one another. Many of them started this journey as women who had faced the same struggles: discrimination, obstetric violence, and a lack of information and respect. Through their work, they gain access to spaces and opportunities they had never had before. They experience a personal form of activism, one that strengthens their confidence to stand up for themselves. They also represent the program at workshops and public events. They bring their voices to places where they weren't heard before. This is how their story travel, and this is how their presence grows. All of this, through solidarity and peer support, is what makes long-term sustainability possible. This is teamwork. And one of the program's most important lessons is that initiatives responding to deeply rooted systemic problems cannot be treated as short-term pilots. Once women and doulas have experienced this impact, withdrawing support would leave a profound gap in the community. Every woman deserves to feel safe, to be respected, and to have control over her body and her choices. And that's exactly what these doulas fight for, every single day. Thank you.
Thank you, Eliana, for that powerful reminder of what feminist community-based care can look like, even in restrictive environments. Next, we'll hear from Moldova, Catalina.
Hello, everyone. Thank you so much for being here. We are strong in few numbers today, but that's all right. We can handle that. So today, thank you. Thanks. Today I'm going to talk to you about a situation that happened in Moldova recently, as of January of 2025. Next. So Moldova was one of the first countries in Eastern Europe to integrate telemedicine medical abortion into its national protocols. For 5 years, it provided women, especially those in rural areas from disadvantaged communities, with safe, private, affordable abortion care, fully aligned with the latest WHO guidelines. Well, in 2025, things have changed. Our progress was abruptly halted by a politically motivated ban, which triggered national and global feminist mobilization, thanks to our friends at ASTRA network. Next. So basically, we started in 2020. Access to medical abortion care in Moldova was unequal and stigmatized. Rural women often had to travel long distances for the service. They had to hide their decision. A lot of waiting by the doctor's office was happening because there are just a few major cities in the country, and they had to go to the particular major cities to get care. Also, there was a lot of social pressure and privacy concerns that discouraged them to seek care early. Our center, the Reproductive Health Training Center, has worked for years to decentralize services and train providers. So the logical next step was telemedicine to improve equity and self-care. Next. How we started. In March 2020, during the COVID-19 lockdown, while the healthcare system was quite paralyzed, we, with the help of the Grand Challenges Canada, the Options Initiative, and the support from our Ministry of Health, launched a pilot study to assess the feasibility of including telemedicine as a service delivery for medical abortion. All the consultations for women were held online or by phone. Medications were delivered safely by the postal services, and the follow-up counseling was also done remotely, also online or by phone. We ensured continuity of the essential reproductive health care during a pandemic, while maintaining privacy, safety, and dignity for each of our clients. Next, please. What we achieved. So in the first year alone, we did not expect to have so many people that we could help. So over 500 women accessed telemedicine medical abortion safely. We had a 98% success rate, had no major complications, and had 90% user satisfaction. Most of the women saying that they will choose telemedicine again. The service became a regional resource. I want to add just a little bit of thing here. A lot of people from Moldova have to travel to different countries in Europe, better income countries, to make money. And a lot of our women end up in these positions. So many of them were benefiting from this service being offered by telemedicine because their friends could come and pick up their pills for them, put them on a bus, and then the person in the country where she would work would call our doctor and would talk to us or would do it online. And also we had a lot of women from restrictive laws like Romania and Ukraine during the war turn to our providers for help. I already mentioned about, yes. So basically by having our country with the little hub for telemedicine as a service provision for medical abortion, we were not only helping our women locally in our country from our communities, but also we're helping a lot of women around our country. Next, please. So as I mentioned, we ended up becoming a regional model. Moldova's Ministry of Health institutionalized telemedicine medical abortion in 2021 while updating national standards that align with the WHO 2022's abortion care guidelines. Our model was later replicated or inspired pilots in many countries around us, like Georgia, Ukraine, Kazakhstan, Kyrgyzstan, Uzbekistan, and the separatist area Transnistria that is a part of Moldova. Through the Regional Reproductive Health and Rights Coalition, Moldova shared its protocols, we shared our training curricula, we shared our lessons learned to help neighboring countries modernize their abortion care frameworks. Next, please. In 2024, a surprise came towards us because a petition that was signed only by 18 individuals, none of them experts in SRHR or even medical professionals or even with any medical background. They were employees of Moldova Gas, which is the main company that delivers gas services. There were a bunch of people that were retired, and amongst them, there were only 3 women, so they were mostly men. It was, the language described there, amongst other things, is that Moldova is the teleabattoir for our unborn children. It was absurd, but it was insanely that it gained traction because it was an election year. The government had quite conservative narratives when it came to advances in reproductive health, so it was quite politically convenient for them at that time. So what began as a misinformation evolved into direct political interference in health policy. Next, please. What we did, we obviously didn't stay quiet to this petition. Our center, plus a lot of medical professional associations from Moldova, immediately responded and wrote to the Ministry of Health, providing them not with just, I don't know, unbacked letters. We gave them all the data that we had from the previous pilot. We gave them, shared all the successes that we had. We gave them all the necessary information regarding the latest WHO recommendations and the legal backing. We gave also a lot of examples from countries like France, UK, and other countries in Eastern Europe and Central Asia region that have success still to this day. Yet our ministry refused to even engage us. We didn't receive a response back even to our explanations, and chose to go with the petition's emotional language instead of the scientific reasoning. Next, please. The ban happened on January 23rd, 2025, when the Ministry of Health issued an order banning telemedicine, medical abortion as a service delivery, citing a lack of a regulatory framework. This decision forced immediate suspension for services, left women in Moldova and abroad without safe access, and undermined WHO-aligned national standards and years of progress. So basically, a service built on science and women's trust was replaced overnight by silence and uncertainty. Next, please. What we did right after we found out. I personally had reached out to ASTRA network. I wrote an email to Eva asking her for help, what we would do. Immediately, ASTRA network helped us launch a petition that in quite a very short time, how many weeks was that, 2 weeks? 2 weeks. Yeah, less than 2 weeks, we gathered 500 signatures from around the world, and it wasn't just private people that were signing up. We had WHO experts, big names like IPPF, Amnesty International, and other major SRHR organizations sign it. We, together with ASTRA Network, coordinated advocacy and media outreach events. Amnesty International even elevated the issue globally as a human rights violation and published a report regarding this. This wave of solidarity surprised us because we, as a former USSR country, usually do not have a very loud voice to defend ourselves, and this was amazing to have help to use our voice, to show us how to use our voice. Next, please. A little breakdown of what you did. So in February, we put out a public statement and had a national expert roundtable regarding this. On May 3rd, we organized a regional conference on self-care and reproductive health, where we presented the issue to over 50 people that were from Eastern Europe and Central Asia countries, as well as global partners that we had present. In June, we had a joint advocacy meeting with partners like Amnesty International and the local media. And post-election, we had some good news. The Ministry of Health was replaced by somebody else. So we hope that now we have a better traction to maybe reinstate this service delivery. We plan on approaching this with maybe different advocacy strategies. We have to clarify the legal provisions of what exactly they want us to include and describe in the standards in order to accept this service delivery again, and hopefully have it this well explained to have sustainability. Next, please. What we learned from this, and are still learning, that progress is fragile. Even WHO-aligned services can be undone by politics. That evidence must be coupled with advocacy and public communication, and that regional solidarity works. Collective feminist action protects social and reproductive health and right advances. Our next steps are to fight by advocating to USA TMA with clear regulation, expand training for medical providers beyond doctors, continue integrating post-abortion family planning and self-care into services, and use Moldova's experience to help other Eastern Europe and Central Asia countries strengthen legal resilience. I have a closing message from the director of our center. She is a WHO expert. Her name is Rodica Comandant, and she always repeats this. Telemedicine is not about technology. It's about access, equity, and first of all, trust in women. Telemedicine abortion in Moldova was safe, effective, life-changing, not just women from Moldova, but also for many other women across the region who found refuge in our system. It actually helped them. This suspension showed how fragile progress can be, but also how powerful our feminist networks are when united. We will continue to fight to restore this right, because science, rights, and solidarity will always outlast fear and politics. Next, please. Thank you, everyone. I appreciate it. Thank you.
Thank you, Catalina, for illustrating how collective action and solidarity can counter aggressive policies and build stronger regional alliances. Finally, we turn to North Macedonia. Baryan.
Thank you, Eva. Good afternoon to everybody. Thank you for your attendance. As Eva introduced me, I'm Borjan Pavlovski from Macedonia Association for Emancipation, Solidarity and Equality of Women, ASTRA. And I will present the situation regarding the basic sexual and reproductive health and rights and access, especially the vulnerable women in Macedonia, to the healthcare services aimed for sexual and reproductive health. Next. So basically, we are a country where our legal regulation looks perfect, almost perfect. We have a guaranteed universal health coverage. Access to primary health care is guaranteed to every woman. Even we have foreseen a gynecological primary health care guaranteed for every woman. But in the reality, things are quite different because in half of our municipalities, there is no primary health care, primary level gynecologist. So basically, 50% of the women from the country do not have access to gynecologists on the primary level, although it is guaranteed. Budgets are not sufficient for the policies aimed for women's sexual and reproductive health, although the policies are in place, also looking perfect. And also women that have access to the gynecologist, physical access, are facing financial barriers in access because all of the gynecologists in the primary health care, although the services by law are guaranteed to be free of charge, unfortunately are unlawfully charging all the women for their services because they are few and they are scarce, and they use this opportunity. Why is this case in our country that we have very good laws and very good policies for women's sexual and reproductive health and for health in general, but we face huge problems in the implementation, mainly due to really low or weak or even non-existing accountability mechanisms. We are a rather small country, 2 million people, and our health care system is highly centralized. So all the decisions are made within the Ministry of Health on national level without taking in consideration the specific needs of different populations, especially vulnerable women, among which the most vulnerable are women from Roma ethnic minority and rural women. So the policies are brought on a national level, always aspiring to achieve to make the achievements of the European Union, but we are still far to make those achievements, and that's why we're filling the gap. Accompanied with the lack of funding of these policies, which are put in paper, but really not funded to be efficient and to be effective and to reach as much as women as they can. Next, please. So this is just one of the examples that 95% of Roma women and around 94% of rural women stated in our research that they were charged by their gynecologists and primary health care during their last visit, although, as I said, this should be free of charge examinations. Next, please. Due to many different barriers, also, although we have a cervical cancer screening program since 2012, so it's about 13 years, still due to lack of funding, due to lack of gynecologists, due to lack of knowledge of women about the existence of these policies, still the coverage is very low. Only 28% in a 3-year period, despite the international standards that the cervical cancer screening is effective only if 75% of the women are reached. That's why even lower among Roma women, just 12% among Roma women and 26% among rural women, which are a bit better than Roma. That's why we have the highest cervical cancer incidence in the region. We have high mortality. Around 60 women die, and it's a population of 1 million women only. So very high death rate from this cancer, which is totally avoidable. Deaths from this cancer are avoidable through the timely screening and HPV vaccine, which is available again, but very low coverage, unfortunately. Next, please. Yeah, so this is just an illustration that the desired coverage is 75%, but we are far, far below, only around 30%, and Roma women facing the lowest coverage with cervical cancer screening program, and this is for years. These problems persist. It's not something that happened right now. As I said, for the 13 years, the problems persist, and there is a lack of political will to put more funding and to put more efforts and people in this program in order, majority of the women to be covered. Next, please. As I said, rural women are one of the vulnerable groups of the women in Macedonia. So 32% of the rural women reported unmet need of gynecological care. Even when they had a need, they were not able to access the gynecologist because gynecologists are far away from their homes, lack of public transport, poor road infrastructure, facing additional costs to access the gynecologist, plus the unlawful charges. And also, there is a lack of knowledge and ability of rural and Roma women to use the new digital tools that our government is putting in place. As I said, we always want to be ahead. We want to digitalize our healthcare. So they made electronic appointments with the gynecologist and electronic appointments for the cervical cancer screening program. But this is, it can be seen as an advantage. But yes, it yet is another barrier for the vulnerable women, which are facing low level of literacy and even lower levels of digital literacy. So these women need to travel quite long distances to get basic primary healthcare services and to face additional charges, accompanied with lack of knowledge of their rights and entitlements. Next, please. Among the Roma communities, as I said, the most vulnerable and marginalized ethnic group in our country and in entire Europe, I can say, there is a 43% of unmet need for gynecological care among Roma women in our country. 60% of Roma women did not visit a health provider in the first trimester of their pregnancy. So even their lives are in danger because there is no medical checkup during the first trimester of the pregnancy for 60% of the pregnant Roma women. And also the development of the newborn is at stake. So even from the early beginning, not just the health of the woman is endangered, but they face less advantage start in their life, the Roma children, because the poor health care during pregnancy. Also, only 12% covered by the cervical cancer screening program, and unfortunately, they face generational poverty, exclusion, and discrimination in every sector of the society, including healthcare. Although we do not face many open discriminatory attitudes of the healthcare professionals anymore, still this apologies. Still, this hidden discrimination hinders access of Roma women to the healthcare services, especially if they are not in their community. They are reluctant to go in the other parts where, where other ethnic groups live to take services. They prefer to stay in their own community. Next. As I said, there is huge public financing gaps for our health programs. And there's for the cervical cancer screening program, there is allocation of around 110,000 euros, but that's why it covers so low percentage of women, less than 30%. On the other hand, we need at least near to 600,000 euros for the coverage of the 75% of women. It maybe looks a lot, but it's not a lot, because annually 300 women are treated from cervical cancer with aggressive treatment, oncological treatments, including surgery and chemotherapy and so on, which are much more expensive than this amount that can be allocated for prevention of the cervical cancer. On the other hand, there is low level of budget transparency. Indicators for the success of these programs are sometimes unclear and not publicly available, the results, in order to track the indicators for the civil society organizations or for the people themselves. This is just an illustration about the gap of the funding from the allocated 110,000, when the real need is almost 600,000 euro per year. Next one. Another health policy is our program for health of mothers and children, which is aimed specifically for vulnerable groups of women, but also facing many problems. They have introduced the preeclampsia screening program in 2024. Only one woman did the screening for entire year, and then they cut this measure from the program. There is no more preeclampsia screening in the 2025. Also, this program foresees free examination, holistic approach towards the women victim of sexual violence. Although in our country we have officially registered around 33 women annually victims of sexual violence, only one woman received this holistic and free of charge medical treatment under this program, because unfortunately, as many other services, and these services are concentrated in the capital city, in Skopje, women are not informed, not even the police or social workers, or nobody is referring them to this center, which is a specific center for women victims of sexual violence, so it remains unused, although it is well equipped with equipment and staff. And as I said, indicators exist for this program as well, but they are not quantified, and there is no lack of transparency, lack of reporting what is achieved and what is not. Next, please. Under this program, we also have guaranteed access to contraception and abortion for vulnerable women. Abortion in Macedonia is, according to the law, every woman has the right to abortion until the 24th week of pregnancy, not just by medical causes, but also by social causes. So the women, by their own choice, can make the abortion until the 24th week of the pregnancy, until the 12th week without no restriction, and until the 24th week there is a need for approval from a commission, but usually every case is approved. But this program is aimed for vulnerable women. And contraception, unfortunately, although there is a variety of contraceptives available, only one of them is on the reimbursement list of the health insurance fund. So women that want to use oral contraceptives must pay for them. And this program provides free contraception for vulnerable groups of women. But in 1 year, only 27 women used these free contraceptives and only 2 packs per woman. You are quite well aware that this is not enough to cover the oral contraception for a vulnerable woman, for any woman throughout the year. Again, this service is concentrated in the university hospital in Skopje, which is absurd. These services should be available in the communities where the vulnerable women live, not in the university hospital. And nobody is referring women. Women have no idea that this service exists. These 27 women just accidentally found themselves in the university hospital and received contraception. So lack of mechanism and lack of inclusion of the communities in the program implementation as well. Our country is trying to replace the surgical abortion with the medication abortion. But again, the state is not providing sufficient funds. And again, the medication abortion is available only in the university hospital in Skopje. Again, another absurd, no dispersed system throughout the communities and throughout other municipalities. So as you said, we are trying to make some achievement, but somehow many barriers are here on the way. So not enough women are using these services. And also the criteria for vulnerable women are remaining undefined, which either can be abused or not all vulnerable women can be entitled to these services. Next, please. So what is my organization as approach to these problems and barriers that women face? For almost 15 years, we are applying the social accountability approach, which is a multi-level approach. On one side, we do the community-based work, where we empower women, especially from Roma and rural communities, about their rights and entitlements to the free contraceptives, to the cervical cancer program, to the program provisions from the program for health of mothers and children. They need to be informed. Nobody informs them. They have no idea that these programs and services exist. But on the other hand, we do also health education in order to inform them about the benefits from using these services like the cervical cancer screening or contraception or other services. On the other hand, we do a national and local level budget and program monitoring to see where the bottlenecks are, whether the funds are sufficient, whether they are provided, whether they are reaching the health facilities on the local level, and also to see where are the gaps and where are the gaps in accountability. Who is not doing their work? It's the ministry, it's the hospital, or it's the primary healthcare provider. So we have seen in many cases that even the hospitals are doing much more services, and the ministry is paying for less, as for the case for the medical abortion. The university hospital is doing much more medical abortion, but they are not paid by the Ministry of Health sufficiently. So the services are deteriorating time by time because there are debts towards the health institutions in our country. And we gather also, what is the most important, we do community-based monitoring, and we gather what are the obstacles which vulnerable women face in access to sexual and reproductive health services, but also we are asking them about their needs, what needs to be changed in order to improve their access to these services. So basically, we use all of these findings, community-based findings. What are the community constraints? What are the community needs? What are the budget and programmatic channels, bottlenecks and constraints? And we use them in our advocacy work in order to improve access to basic healthcare for Roma, rural women and other groups of women. Next, please. Yeah, so basically, we also offer paralegal support in the community rights literacy. We document the violation of rights and refer cases when needed. We empower women to proactively demand services. And we also gather data to the budget and program monitoring, and we use it for the advocacy, including media, working with media, and policy dialogue, because we were included in the most important policy dialogues in our country regarding the improvement of the health care system. Next, please. When I was speaking on this issue, what was achieved for me, the most important achievement of the community-based work is the marginalized women are getting voices, are being heard, they are empowered, and through this community-based work, their voices can be heard up to the national level, on the media and everything, and they start to proactively demand services. Changes cannot happen overnight, especially with so many problems, but at least the main and most important achievement is that the marginalized women are empowered and are asked for their opinion, are asked for their needs, and their opinions and needs and constraints are reaching the national level policy-making process. Of course, throughout the years there were achievements like opening of the gynecological office in the largest Roma municipality. It's still working. In the programs we had specific activities aimed for Roma women, like outreach, targeted outreach with cervical cancer screening, with other healthcare services. And throughout the years, we are building data and collecting data which policymakers cannot ignore, because they are grounded in the community needs and community realities. Okay, these are our main policy demands, our main advocacy demands, which is clear from what I have presented: to provide accessible and affordable gynecological health care for all, to sufficiently fund programs for women's health, to end unlawful fees, and to reinvest in contraception and medication abortion as well. And most important, our state needs mechanisms to include civil society organizations and citizens, especially vulnerable groups, in policy-making processes and in service delivery. Next. So the main lessons that we have learned is that community-based, feminist community-based activities, which are accountability-based, they are empowering women, thus resisting the anti-gender agendas and discriminatory systems, because the women are empowered, they know their rights, they know how to defend their rights, and the civil societies are here to help them in these processes. And of course, we are equipping community with knowledge, and with community systems, with grassroots CSOs, able to help the women to claim their rights, to access to services and other health rights. And of course, in this work, we are working from the margins. We are bringing the voices of the most marginalized, vulnerable communities to the national policy level dialogue. Next. Thank you for your attention.
Perfect. Thank you, Borjan, for showing us how local organizing and community leadership are transforming access to healthcare and demanding real accountability across the system. Okay, does anyone have any questions for our panelists? Yeah, we have a question. Do you want to come up, or wow? Okay, wait a second. Thanks, I'm not very good with the microphones.
Thank you, and thanks to the panelists. Hi, my name is Kelsey Armstrong-Valenchuk. I almost don't know where to start, so first I just want to say thank you so much for your very powerful testimony. I'm an American citizen. I'm married to a Polish citizen. My children are Polish. I spent some years living in Poland. So in a way, I actually feel like I lost my rights twice over, which is not a very good feeling. But in 2015, I left Łódź and moved to Geneva, Switzerland. And in 2016, I joined about 50 women in the Parc des Bastions for a Czarny Poniedziałek demonstration. It was very, very small, but we all went there because we felt we had to do something. And so my question is, do you think these tiny little demonstrations, are they helping? And what more can we do because we so badly want to support you? Thank you.
Do you want the cake question?
Yeah, I mean, obvious answer is, of course, they work and they are much needed. And before we had elections, as you probably know, in 2023, and although we had great ambitions and we hoped for the change of law, the fact is that those grouping and solidarity of women and feminist movement and the women that went to parliamentary elections, this resulted in change of power in Poland. And Conservative Party, Law and Justice, is not into force now. We have another party, Democratic Party. Yeah, we still wait for the change of the law, but yeah, that was women's work and small communities' work and all the actions that you just mentioned. So yeah, it's much, much needed. And I feel like in Poland and basically everywhere that we discussed today, we need solidarity, especially because, of course, we can have it in capitals, in Warsaw, we can have great, big gatherings, but we need it across the whole country. So it's much needed. And how you can support us?
Well, never shut up. You know, silence is not an option. So make sure that you preach, you spread the word, that you let everyone, you know, in the international audience that we have a problem, we have a serious problem, and it's not going away anytime soon. Not only in Poland, but also across the region, Central and Eastern Europe and Central Asia as well. So yeah, again, just being vocal, you know, and making sure that they hear our stories. Emma, Juliana, Florian, Catalina, do you want to add something? Okay. Okay, thanks. Anyone else? Okay. If we don't have any other questions, well, with that, please put your hands together for this amazing, brave, bold, courageous activist from Central and Eastern Europe. Thank you so much. And follow us on Instagram, Facebook, social media. Keep in touch with us. We need you, okay? We need you. We need your voices, your support, your help. Thank you so much.